name is Wendy. I'm the manual osteopathic student. So right now, after we do the assessment of your osteoarticulations and your MFR, we're going to move forward with this cranial treatment and cerebral fluid treatment, where we'll be able to treat and then reassess again based on the assessment that we have, and then do the reassessment. So right now, I'm asking for the consent for first touch you with this treatment, and the second one is to consent to treat you. As far as you're concerned, I'm still a student, so there might be the risk that might give you more pain like after this treatment. That is normal as part of the learning, but it's tolerable. And then the benefits for this, it's like giving you an example for the range of motion of your neck. It could be more increased and then more lessen the pain, and it's also giving you what do you call this? The range of motion increase, the lesser the pain, and it could also help you with the relaxation. Okay, so do you have any questions before we proceed?
No.
So I'll be touching the whole neck and your body. And do I have the consent?
Yes, you have my consent.
Okay, thank you so much.
You're welcome.
So now you're going to lay down
Okay.
on face up position.
Okay.
There you go. So I'm gonna do the dorsum. So I'm gonna feel it right now. So symmetry, it's not symmetry, and the quality is soft. And then the amplitude, I'm gonna count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10, 11, 14. I should say the total for this is 2. Now I'm going to the sing. I'm going to do the listening. So now I am checking on the symmetry. Symmetry, yes, it is symmetry. The quality is soft on the right. Yeah, on the right and the left side is 30. And the amplitude is, this is 1, 2, 3, 4, 6, 9, 10, 11, 12, 13, 14. Total rate for this is 3. So I'm touching now your thigh. I'm listening to this. So symmetry, yes, it is symmetry. The quality is soft on, yeah, soft both sides. Amplitude 1, 2, 3, 6, 8, 10, the rate, I just say like total score is 3. Now I'm touching now the ASIS. So symmetry. Okay, so now in here it's symmetry. And then quality on the right, it's more softer than the left. And then amplitude, it's a full range, and it's medium. And then now for the rate, 1, 2, 3, 4, 5, 6, 9, 10, 11, 12, and the total load for this is 2. I'm going now to the lower rib. Moving on for listening. And now I am doing the symmetry. It is not symmetrical. And now the quality is even. It's 30 on the right and the left. Amplitude is medium. And now on the rate, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and the total rate for this is 2. Okay, now I am here on your shoulder and listening. Symmetry, it is symmetry. It is quality more soft on the left than in the right side. Amplitude low on the, yeah, it's low. And then the rate is 1, 2, 3, 4, 5, 6, 7, 8, for this is we say 1. Giving you the treatment with the diaphragms, which is the global, and the local is the OCB and diaphragm. So, can I put my hands to your sacral at the back and left there? And then now I'm going to touch or put my hands superior to your pubic. And then I'm gonna feel. Do you have any IUD? No, because it's one contraindication. Okay, and now I'm feeling this. And release. I'm making to release the fascia and good. So now I'm moving on to your T, let's say your T4, T5, and then lower rib. Okay, I'm going there. And then we do the fascia to release. Perfect. There you go. So now I'm going to put your hand to the T1, T2, and below of your clavicle. And then wait for the tissue to release. And then release. And now I'm putting my hands to cervical 1, 2, 3, 4, and then the hyoid bone when you swallow. And then wait for the tissue to release. There you go. Almost floating right now. And release. So at this time, I will be holding or making the Volt 1 to assessment of the anterior cerebelli. So I'm going to put my hands to middle and the ring finger in between the ears and temporal bone and parietal bone here. And then this is assessing for the widening and narrowing of the cranium. So I'm gonna wait for, so this for symmetry, the quality is soft, the amplitude is medium, the rate is 1, 2, 3, 4, 5, 8, 9, 10, and the rate for this is 2. The Volt hold 2 for the assessment of the falx cerebri and the cerebrum. So as a therapist, we're going to hold or cup the frontal or the occipital bone and then the frontal bone, and this is for assessing of the clamshell, like assessment for the clamshell motion of the cranium. And now I'm doing the listening, the symmetry, yes, it's symmetry, the quality is soft, the amplitude is medium, and then the rate for this is 1, 2, 4, 5, 6, 7, 8, 9, 10, and it is the rate. Total score for this is 2. Time I will be assessing the Volt hold 3, which is the assessment of the spinobasilar and spondylosis joint. So as a therapist, I'm holding on the occipital bone, and my thumb will be on the sphenoid and sphenoid bone bilaterally. In this time, it's assessing like a clamshell and feeling this, listening, the symmetry, so extension and flexion on the lateral movement is symmetry is not symmetrical, the quality is soft, amplitude is low, and the rate is 1, 2, 3, 4, 5, 6, and the total rate for this is 1. cranial based. So right now, I'm doing the 4 steps. First is to soft the tissue. I will gonna put my hands on the occiput and wait the tissue to release. And so I'll place together the occiput and the fingertips with the occiput under C1, and then hold to support the palm on both hands. And now the second is the platform, which move to the C1, anteriorly releasing to the occiput and C2. So at this time, it is the fingertips posteriorly to the C1, and gonna wait for the tissue to release towards the orbit of the eyes, and allow the weight of the head move forward to the head of the back of the palm. Now I am doing the gapping, so I'm going to do the contraction of the finger 3 and 4, attraction, and wait for the fascia to release, or the tissue to release. And now is the spreading, so I'm going to spread my fingertips to reset the condyle on occiput to this occiput, both of my hands in the occiput, and gently spread the occiput bilaterally. And so at this time, I will be treating the local for the parietal bone. So I will be putting my hands to the parietal bone. But before that, I would like to let my client clench the jaw so that I could be able to touch the parietal bone. Okay. And okay. That's it. Okay, now I'm going to place my fingertips on bilaterally around the parietal ridge. Gently compress medially 5 grams so that it could be able to move the bones medially to release the squamous surface or sutures. Now I am feeling the release pressure. I have to wait like 5 to 10 seconds, and then now I feel very gently. I traction the parietal bones in superior direction towards me to release the falx cerebelli and falx cerebri, and then wait for the soft tissue, and then the parietal bones will gonna float freely. There you go. You feel that? And I'm going to do the reassessment after the treatment. So I'm holding now the dorsum for the score. Symmetry, it is now symmetry. Quality is soft, and amplitude is medium. The rate for this is 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then the total score for this is 3. So I'm going to do the same. So I'm going to do the symmetry. It is symmetrical. The quality is sturdy, a little bit faster, and amplitude medium, and then the full range, and rate 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. I'm gonna rate the total score for this is 2. For the time, so I'm gonna do the listening for this symmetry. It's symmetry, and quality is soft, even. Amplitude is medium. Rate is 1, 2, 3, 4, 5. 8, 9, 10, 11, 12. Total rate for this is 3. ASIS. So I'm do the listening. For symmetry, symmetry, quality is soft, and amplitude is medium. Rate is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And rate for this is 3. So on the lower rib. So now I'm listening. Symmetry, it is symmetry. Quality is soft now. Then after this, the amplitude is high. And the rate is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. We're going to rate this total score of 3. And for his shoulder, so symmetry now. It's symmetry. Quality is softer. Amplitude is medium. Rate is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Total rate for this is 3. Right now, I'm going to reassess on the volt 1 to 3. First, the volt 1. So, I'm going to put my hand on the head of my client and gently cup the parietal and temporal bone bilaterally. And this is the assessment for widening and narrowing of the cranium. So now I am checking the square. Symmetry. The quality is soft. Amplitude is high. And the rate for this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. And total score for this is 3. Reassessing for the volt 2, which is the assessment of the falx cerebri and the falx cerebrum. So I will gonna hold my client's occiput slightly on occipital bone, and the other fingertips will be on the frontal bone, and assessing this one for a clamshell motion of the cranium. So like I'm gonna feel towards the eyes and towards the feet. Towards the eyes and towards the feet. So for the square, this is symmetry. Quality is soft, smooth, and amplitude is medium. The rate for this is 1, 2, 3, 4, 7, 8, 9, 10, 11, 12. And I'm gonna rate for this as 3. And there you go. Reassessing the volt 3, which is the assessment of the spinobasilar and synchodrosis joint. So at this time, I'm going to hold on to the occiput on my fingertip and the sphenoid on my thumb, both bilaterally, and do the listening. So square symmetry is symmetry. The quality of this now is soft. Amplitude is, this is like a clamshell movement. And the amplitude for this is medium. And the rate for this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16. And now, I'm gonna rate this as 2. Okay, so based on the assessment and we had on your articulations, your MFR, and the clinical impressions that I'm thinking about is more on the impingement nerve that connects to your shoulder, that has the weakest link of your test as we assess you in our IM. And the reasoning for that is, as you work as a massage therapist, it's more pressure that you're giving into your body from your shoulder going now to your head that causes the pain, especially the cervical area, then makes it more dysfunction. So with that, I'll be able to like give you the treatment that we are going to have, especially the global, focal, and local. So I hope this treatment will gonna be help your ease the pain and lessen your pain. Okay. So after this, you have the homework, and you're gonna do the neck stretches. So I'm gonna send you the stretching exercises for your neck as you go to the flexion and extension and hold it, and then count 16 counts, and then go to the lateral sideways, and then I'll send you the videos just to add more on your homework. And don't forget to drink a lot of water. It's part of your daily routine as massage therapist. So any questions regarding with our treatments?
No, it sounds good.
Thank you so much.
Okay, thank you.